So I'm a nurse care manager with Meritage Medical Network, and what I mainly do is follow up with patients after they've been in the hospital, make sure they have their appointments, their medications. We do that for about 30 days and then follow up as needed. For the patients, instead of having the insurance companies managing everything, they have a local touch on it. Because we can talk to the patients, we have the time to talk with them and find out what's needed and provide resources in the community if needed. Whereas the hospital knows some of the resources, but they may not have all the connections that we have. Jim came on my radar last January. I was assigned to him, and once he went home from the hospital, I followed up with him to make sure he had everything he needed. Before COVID, the case managers would go and meet patients in the hospital, go and meet them in skilled nursing facilities, and then go meet them at their home. But since COVID started, we've had to transition everything telephonically and virtual. And so unfortunately, right when Jim was discharged is right at the beginning of COVID and the restrictions, and so I was never able to meet him in his home. Despite that, we've still been able to accomplish a lot working together, and it hasn't hindered his progress.
When I first met Gina, she was warm, she was empathetic, she was very, very sharp, not missing anything, and able to just find out what is needed and how to help the client. With the first seizure, there was some damage. Basically, it scrambled some of my languages. And so having somebody help me to get speech therapy helped a lot. And Gina's kept finding places for me to continue the speech therapy.
Hi.
Come on in.
Nice to meet you in person.
Nice to meet you. For real?
Jim has grown tremendously over the last year and a half. He worked with me, and he worked with a social worker with the home health agency to kind of figure out how he could live on his own and still be really independent, which is where he should be. It means a lot to hear that Jim is feeling so hopeful. I mean, that's why I do what I do. It really helps get through some of the tough days too, to remind myself, when there's some really tough cases. It's like, no, I'm doing this because I love working with the patients, and I know I make a difference in at least some of the patients' lives.